So, thank you girls for joining us. It's wonderful to have you on. And thank you to all of you out there in Instagram world for joining us for tonight's Instagram Live, where we're going to talk all about imposter syndrome. What I'm going to do before we get started is just introduce a little bit about imposter syndrome. And then we're going to have a chat with our fantastic buddies, Freya, Tianee and Hannah, all about their experiences of imposter syndrome, as well as how we can try and combat this situation. So first of all, a couple of quick definitions about imposter syndrome. So imposter syndrome it's a feeling that is felt by people all around the world, regardless of what profession they're in, what walk of life they're in. It's not just something relevant to physios. However, we do find that there tends to be a lot of physiotherapists, especially those who are students who are going out on placements, or students who are coming to the end of their degree and are just about to qualify, or qualified physios, whether you're a junior physio or a senior physio or even specialist physios. It's a feeling that everyone can experience at some point in their physio life. So, quick definitions. Imposter syndrome is the inability to believe that one's success is deserved or has been legitimately achieved as a result of their own efforts. It's an internal experience of believing that you are not as competent as others perceive you to be, and it's commonly associated with feelings or thoughts such as, I don't deserve to be here, I don't feel good enough to be here, and a fear that I'm not going to live up to the expectations that other people put on you. So, with that said, I'm going to introduce our guest tonight and try and explore a little bit about times in their physio worlds when they may have been experienced imposter syndrome. So first, I'm going to come to Hannah. Hannah, how are you?
Yes, I'm good, thank you. How are you?
I'm really good. Thank you so much for coming on. Why don't you take 30 seconds to tell everyone a little bit about Hannah and Physio World for Hannah, and then we can have a dive into imposter syndrome.
Yeah, so hello, I'm Hannah. I'm 24 and I'm a final year MSc student at the University of Southampton. So I have 3.5 months left.
Wow.
Recently been offered my first Band 5 job. So this for me is quite the imposter syndrome is quite a big one, because I'm like, oh, I don't know if I'll be able to do it.
Absolutely. And there you go. Classic normal feeling. So, Hannah, if I can start, therefore, to ask, well, you've just mentioned one of them naturally. But if I could perhaps start by asking you about examples, including the one you've just mentioned, examples in your time as a physio student that you might have felt this idea of imposter syndrome.
Yeah, so definitely my most recent one would have been being offered my first Band 5 job. I kind of felt like when I got offered it, I only kind of I wasn't really telling anyone, because I was like, oh, until like my contract had come through, I didn't really want to tell anyone, because I was like, they're going to take it away from me. They don't want me to work there.
Wow. I
highly doubt that was going to happen, but like to me, like I didn't really want to tell anyone, like no one, I kind of just told like close friends and family, even then like not very like many people in my family, because I was like, oh, like they're going to take it away from me, which is such a silly feeling. I've obviously earned it, I think, but like earned it. So yeah, it was quite I think especially kind of tying into another kind of example, like being part of like the COVID cohort. Cool. I think is like a massive thing. Obviously I know a lot of juniors and students feel the imposter syndrome, but for me, I think being part of that like COVID cohort where everything we did was online for such a practical degree,
totally with you.
You're a bit like, I haven't got the same skills as Band 5s previously, so why would employers want to employ me if you're up against someone that's done it normally, if you know what.
No, I totally know what you mean. And everything you just said totally makes sense in the context of either whether it be someone not necessarily believing in their own abilities or doesn't feel like they might be able to live up to expectations of what they're supposed to do, as you kind of mentioned in your role as a qualified physio. Has this feeling come to you in other examples, whether it might have been on placement or in terms of exams or anything like that?
Yeah, definitely. I think it always kind of appears, doesn't it, on placement, like especially, you know, the or like especially in your first week, you're a bit like, or you're trying to take on all this information, you're trying to, you know, impress your supervisor and do all of this, and then you're like, oh, but actually I don't think I'm doing enough. Am I doing enough? And then you're like questioning yourself, but you know, you are doing enough. But it is so difficult to, you know, actually be like, I deserve to be here.
Certainly.
I find it very difficult. I don't know about you girls, but yeah, I do. I find it really difficult to kind of be like, I do deserve to be here, but you constantly feel like you have to like prove yourself.
Absolutely. But no, again, Hannah, that everything you've said is totally totally makes sense, and it's some of the really, really common things that people say time and time again when it comes to that. So thank you so much for sharing those examples with us. Let's go over to our twins, Tianee and Freya. First of all, would you like to tell us which one of you is Tianee and which one of you is Freya?
I'm Freya.
Hello. I know. I thought that was the case, but as I'm sure we'll find on Clinical Physio, we'll spend months and months trying to work out which one's who. Girls, lovely to have you on. Thank you so much for joining us. Would you like to start by telling us a little bit about Physio World for the both of you?
Yeah, so we're both 21. We graduated from Brunel University in July, and we both recently started our Band 5 rotations. I'm on medical rehab ward, but currently it's a COVID ward, and I've been there for about a month and a half now. And I have just started 2.5 weeks ago on A&E. So it's very busy, very exciting.
Yeah, absolutely. Very busy. Yeah. So, girls, tell us about, same question that I came to Hannah. Maybe Freya, if I could start with you first. Are there particular examples that come to your mind of when in the past you may have felt imposter syndrome yourself?
Yeah, so I think definitely going into my new Band 5 job, obviously as most trusts, there is an expectation to get your on-call competencies, which I think is great and something really exciting. And I was fortunate enough as a student to have an ICU placement. But I think for me, I didn't really experience any respiratory on the wards. So I think there's an expectation that you should really know what you're doing with like setting up a nebulizer, humidified circuit. I had absolutely no idea because I hadn't been exposed to that. And I think like for me, it was a lot of self-doubt and actually should I know what I'm doing with more of a basic resp task than like deep suctioning or trachea weaning. So I think that's definitely something like maybe I'm comparing myself to other Band 5s and that actually they know how to set up a nebulizer, but I don't. So I think that's definitely something in the first couple of weeks and still now that, yeah, definitely felt.
Absolutely. And you've made an incredibly important point with comparison and how we're a generation where we tend to compare ourselves to others in all walks of life, don't we? But comparison almost fuels that feeling of imposter syndrome because you're looking at other people around you thinking, well, they're doing it. How come I can't do it? And that leads to that feeling of not living up to expectations or not deserving to be there. So, Tianee, how about you? Any particular examples that come to mind for you?
So I had one really recently, like last Wednesday, and I was treating a patient on A&E, and because it's quite a close relationship with like occupational therapists in A&E, and we often overlap quite a lot, like I identified that this patient needed a shower seat, but obviously as a physio you don't get taught anything about equipment, so I didn't know where to start with a shower seat, and I spoke to my team and like there was a lot of things that I wasn't aware of with regards to like the height and like the shower base and all this. And so I ended up asking like a million questions that day, and it took me like 3 days to work out and discharge this patient because everything went wrong along the way. But I just felt very like incompetent, and the fact that I had to ask so many questions just felt a bit, yeah, a bit rubbish. And then at the end of the day, I just reflected and thought, wow, like I feel like I know nothing.
Sure. And I think, if I may say, knowing the both of you, I know you both, and Hannah as well, you all set very high expectations for yourselves. And so I know that you would have been itching to be like, I got to do this. I need to be able to demonstrate I'm worth doing this. I need to demonstrate to my OT colleagues that I can help them in doing their role. But that totally makes sense of examples that you've said there. And then if I may, I was going to chuck in an example of my own to demonstrate that, imposter syndrome is not just something that hits you as a student physio or as a very recently qualified physio, but even for myself, when I was working most recently as a band 7 or specialist physiotherapist, I started working in an orthopedic consultant's clinic alongside an orthopedic consultant who specialized in the knee joint. And I love the knee, and I felt as if I had plenty of skills in terms of assessing and diagnosing problems in the knee joint. Only to find, of course, that when your consultant assesses a knee, it's completely different to your assessment. And he reads MRIs like this, and he reads X-rays like that, and he explains things to the patient like this. And very, very suddenly you kind of feel this, oh goodness, maybe I'm not supposed to be here. Maybe I'm not good enough to do this. Maybe he's expecting all of this of me, and I can't do any of that. And so again, I just want to kind of point out that it's not just something that happens when you're early on in your career. And I hope that's reassuring rather than worrying, that people of all different backgrounds and all different levels of seniority within the physiotherapy world can have those moments of doubt, as Hannah, Freya and Tianee have mentioned. So I suppose the next thing I wanted to kind of come on to, girls, if I may, and Hannah, I'll start with you. Over the course of your placements, as you said, and how you've been feeling recently in terms of your new band 5 job, have you come across any methods or ways or thoughts that has helped you combat this feeling of imposter syndrome?
I wouldn't say like anything specific, but I think it is just definitely reminding yourself like you're here for a reason, and like, you've worked so hard to get where you are. Like, that is enough. Like, you are where you are because you deserve to be where you are, not, it would have been picked up, in the first, couple of months of your degree if you weren't supposed to be here. So, and I think you said it earlier, like, I definitely set very high expectations of myself, but you're never going to know everything. No one's ever going to know everything. And I think I definitely, especially when I'm on placement, remember that everyone was where you were at some point. Everyone that you come into contact with was a student. They also didn't know what they were doing.
Absolutely.
I think that always helps me kind of settle, like, in my head. I'm a bit like, at one point, yeah, they've been qualified 20 years, but 20 years ago they didn't know what they were doing either. So makes me feel.
Absolutely. And you couldn't be more correct. It's absolutely the case. And I definitely remember lots of my student placement experiences and remembering what that felt like. I remember my first NHS rotation was in a care of the elderly rotation. And on my first day, not only was it my first day, but it was also my physio assistant's first day on this new ward that we've never been to before. And within 20 minutes of walking onto this ward, we were suddenly in front of the consultant doing a ward round, being asked, why isn't this person being discharged? And then what's happening with this person? So absolutely, we've all been there and done it in one t-shirt. Hannah, here's another question I'm going to ask you. Do you find, or have you had the chance to discuss with any of your fellow students, peers, have they also felt this kind of feeling? And have you had the chance to talk about it with other people?
I think you know, I definitely know that my peers have felt the same way at some point. I think everyone does. And that's also a really important point to take away, is that, you know, everyone feels the same at some point, and gets that feeling of imposter syndrome. But I think when I was on my last placement, it was quite a difficult placement. And I remember feeling exactly like, I don't know enough to be here. And at this point, I'd been offered my band 5 job, and I was like, I don't know enough to be a band 5. And actually one of the band 5s asked a question to one of the seniors, and it was a question that I exactly would have thought as well. And I looked at her and I was like, I am so glad that you said that, because it makes me, she'd been qualified like a year, and I thought, oh, that has just made me feel so much better. And talk definitely with like some of the band 5s on my placement, they definitely make you feel, you know, very calm in the fact that, you know, you're not going to know everything when you start, and that's okay.
Absolutely. We made some absolutely fantastic points, one of which I'm going to come on to later when we kind of go through ways of combating it further. But realizing that this is, fortunately or unfortunately, a very normal feeling. As physiotherapists, we're all for normalizing things, aren't we? We always try and normalize, for example, that osteoarthritis is a normal part of the aging process, and things like that. And normalizing this feeling when you have first graduated and you're first stepping onto placement, or you're first stepping onto your new ward, it's probably normal that you don't feel as if you're the best band 5 physiotherapist straight away. So I completely appreciate what you're saying there, and great that you were able to kind of take that example of someone else in a very similar position to you and find that, yeah, actually I'm really glad you asked that question, because it makes me realize that actually I'm not the only one. So thank you, Hannah, that's awesome. Freya and Tianee, how about yourselves? In the examples that you've mentioned to us, what ways might you have found to try and help combat that feeling of imposter syndrome?
So I think one way is just acknowledging your feelings, and actually that it's very normal, but trying to work out whether, is it due to like lack of exposure, is it due to like your own like self-doubt. And like for me, for my example, I was very open to my supervisor and said that actually I don't have a lot of experience in this area, and I think a method to help with the imposter syndrome is to increase your exposure and maybe practice more.
Yeah, absolutely. Spot on. And fantastic that you, as you said, seeking that support or seeking that clarity or seeking that guidance is really, really important. How did you find that your supervisor was with you when you did discuss that with them?
Really good. Like, I was maybe expecting a bit of judgment in that actually I can't set up a nebulizer, but actually she was like, sure, we'll go through that in our next supervision. So I think, don't be afraid to ask for help. It's very, very normal.
Yeah, super. And it's amazing, isn't it, that 99% of the time the thought that is going on in our own head is the overwhelming feeling rather than what someone else is thinking. It's much more likely that we have that feeling and we're putting it on ourselves rather than lots of other people thinking exactly the same as us. How about you, Tianee? What kind of methods or ways have you tried to combat that feeling? How did you combat it last week when you were trying to work with your OT colleagues?
So on my walk home from the hospital, I decided to like reflect on the situation, and I was with Freya at the time, so I had a chat and said like how I felt and how I just felt very like incompetent in that situation. So we discussed like what I did, and that actually my supervisor did say that you did a good job and you did exactly the steps that I would have done, but it's just about not adding that additional pressure. And if you are like a perfectionist type of person, then I think you can often like set very high standards of yourself, and you can often feel that it was a not very good like experience for you, but actually like from an external person they thought nothing of it, and you're making it a bigger thing in your head. So I think definitely chatting to people, and potentially chatting to people that are within the healthcare setting, so they have an understanding of what steps you actually did, to see whether you're just being silly and actually you did a good job, or yeah, just so they have a bit more of an understanding about your day.
Totally. I totally agree with everything you've just said. That, and as you said, it's very, very common that the feeling that we have, as we said with Hannah and Freya a second ago, the feeling we have for ourselves is probably going to be much harsher than the feeling that other people have. So just as you said, asking other people about their thoughts about that situation, people are much more likely to side with you and reassure you rather than go against you. For anyone who's watching, we'd love to hear if there's any particular examples that you've had in your physio journey so far that has kind of made you feel that way. So please do chuck those things in the chat if you feel happy to, because I'm sure, as the girls have highlighted, bringing these things up can help a lot of people just by realizing that you're not the only one. But no, Freya and Tianee, I was going to come back to you and ask you, I know you said a second ago that you talked about it yourselves. Do you find that between the two of you, not only in terms of this kind of feeling of imposter syndrome or confidence, do you talk between yourselves a lot about some of the challenges that you face, not only in your qualified physio lives, but also in your student days? Did you talk a lot between you, and how helpful was that in these situations?
Yeah, we kind of always, when we were eating dinner together, we always kind of had a chat about our day, difficult, complex patients. I think it's just a nice way to reflect and highlight some of the strengths and weaknesses. Like indirectly, you might just discuss that actually I felt really confident in that area, or not so much in this area. Yeah, and I think like having each other, like it's like if you were to chat to a person on your cohort, I think because we both do the same thing, it's much more relevant for us. I don't think it'd be the same if you were to like talk about it with your mum, just because if they haven't got that experience, then it might not be as relevant for them to give you advice. So I definitely think it's reassuring in that way.
Absolutely. And especially between the two of you, I can imagine, well, obviously you've grown up together. I was going to say, I imagine that growing up together, you would have discussed all those kind of things together, because you both do, knowing you in the way that I do, I know you do so much together. You've obviously done your studying together, you work together, you do your amazing gymnastic stuff together, which still blows my mind when I see you on the trapeze and things like that. But I can totally appreciate that speaking to someone at the same level as you, or doing the same things as you, or someone who understands the way that you feel, it is a really beneficial way of trying to make those feelings less dramatic in your own minds, and therefore make you feel a little bit more reassured.
Definitely.
Just going down to the chat, let's see what we've got. Eric, I experienced the same thing today on placement. I'm glad it's same day I got to know I ain't alone. Laura, fantastic friend of the channel. Getting onto the course in the first place is very competitive, but also more recently on placement, talking to very senior people in the CSP, the Chartered Society of Physiotherapy. Absolutely, Laura. I mean, there's examples throughout. And I mean, just as, you know, as Hannah explained about getting your first job, especially, and it's a really good point, that especially in this COVID era, as it were, for students, and exactly as you said, Hannah, not having quite the practical experience that you would have perhaps hoped for. But I suppose that the bit of advice that I'd probably give you is that as much as you haven't had those 4 weeks or 6 weeks on a placement learning, I bet you that 6 weeks from now into your new job, whenever that is, Hannah, that you will absolutely feel as if you will have been able to catch up. It's just a different feeling because you are now qualified rather than doing it as a student, but the amount of learning is the same. And definitely for me, I found that the most learning I did as at any time in my physio career was when I was a band 5, not when I was a student. So I'm sure that for all of you, there's so much learning still to come. Megs, thank you so much for commenting. Recently graduated with no respiratory experience, so already feel like I won't be competent enough on my rotations. Totally feel you, Megan, but hopefully you can take some inspiration from Freya and Tianee, and especially Freya when she talked about the the fact that she hasn't set up a nebulizer before, and speaking to her supervisor it, you know, that they kind of very quickly established, no, that's okay, we'll go through it together. One thing I will say, Megan, is that I'm absolutely sure that so many managers, supervisors, certainly if I was, you know, managing new band fives coming into the NHS, I would understand that COVID has had a massive impact on your studies. And therefore, I'm not surprised. You absolutely won't be the only one, Megan, who will have not had a respiratory experience on placement. And therefore, I think I would take it on myself to make sure that I need to help you along that way, because I know that you wouldn't feel as confident, let alone feeling that you have the skills in order to get through it. So, we've got a couple more things. Alex, working alongside other physiotherapists pitch side in a sporting environment that have had years of experience compared to myself who was new, kept looking over my shoulder, kept looking for their approval when doing my work. Another comment, due to COVID, I had to complete a placement where I worked as an assistant, really struggled with the perceived expectations on me. And I hope in terms of, you know, what the girls have said, that voicing that feeling with someone is much more important than, and really important to get out, rather than keeping it in your own head and not telling anyone about it, because unfortunately in there it kind of manifests itself much worse than that if it was a problem shared, which could hopefully be a problem solved. So if I may, following on from some of the fantastic things that the girls have all said in terms of how you can try and combat imposter syndrome, I think I wanted to bring some of my own, a lot of which have been highlighted from our fantastic guests, as I knew they would. First of all, understand why that feeling of imposter syndrome exists. For example, like the girls have said, don't feel equipped enough to deal with the new measures as a band 5, not feeling confident enough given you may not have had the experience and that others have had on placement. So understanding why you feel that way, because it's normal. You haven't worked as a qualified physio before. Of course it's going to be challenging when you start. You haven't done that respiratory placement because of COVID. So understandably, you're not going to feel 100% about it when you come to the real thing. And appreciating that it's totally and utterly normal to feel that way. And I imagine if you took a survey of, you know, all of the physiotherapists who qualified this year going into their first job, I'm sure that the vast majority of them would feel a level of doubt in terms of their abilities. So if more people feel it than don't feel it, that makes it normal. You are not alone, as we've said, in that feeling. As I hope I've been able to identify, it's not just a student or junior thing. Definitely applying for band 6 jobs as a band 5. I was a band 5 for, let's see, almost 5 years, I think beyond 5 years actually, and probably a thought process in that was, I'm not ready to be a senior, I'm not ready to be a senior, I'm not ready to be a senior, which is of course a thought that was completely created in my own head. The other thing I was going to say is, strangely enough, it's healthy. It's a healthy feeling. I saw someone, when I was doing research for tonight, I saw someone on social media saying something like, crikey, I wish all these people who thought they were so brilliant at their job had some imposter syndrome from time to time. In the idea being that sometimes if we, rather than rushing into it, feeling that we're the best at everything, sometimes actually taking a step back and reflecting and thinking to yourself, maybe I actually want to look at that a little bit more before I specialize in it, or maybe I should speak to someone about it, can be really healthy and really beneficial. And then something that Freya said earlier was that one of the best ways to try and get over it is exposure to it, which I completely and utterly agree with. And so I don't get any benefit whatsoever from mentioning this book, but here's a book, I'm sorry, it's probably the wrong way around. Here's a book from a lady called Susan Jeffries called Feel the Fear and Do It Anyway. And you can guess what it's all about. Feeling that fear is normal, but do it anyway. The majority of the time when we feel something like imposter syndrome, or when we feel that self-doubt, the feeling we have inside ourselves is, I don't want to do that. So for example, I don't want to start my band 5 job. I don't feel I'm ready. But the reality is that the only way you're going to feel more confident in it, as Freya brilliantly said, is to get more exposure to it and get out and push yourself off the edge of the boat and try and swim anyway. So definitely feel the fear and do it anyway. And then other things I've written here: be kind to yourself, recognize that you're doing something really brilliant, because if you are feeling that self-doubt, it's because it's a situation that you're uncomfortable in. And if you do more and more things that make you uncomfortable, you're going to progress, not only as a physiotherapist, but also as a person in all aspects of life. And seek support, just like Tianee mentioned, speaking to her OT colleagues, as Freya said, speaking to her supervisor about the situation that she was in. So I'm just going to come back to the chat and see if there's any other things that have popped up from other people. Let's see. I agree. I'm feeling like you aren't 100% equipped is something that I use as a challenge, and it drives me to learn quicker and perform better at my job. So I'm going to come back to the girls one final time and ask, how do you feel about things going forward? Do you feel like, even in Hannah, if I might be able to come to you first of all, for example, even if you don't feel as confident in yourself about doing your new Band 5 job, where do you think you will be, or how do you think you'll feel 3 months from now when you've started that new job and you've been able to get your feet in and you've been able to experience what it's like on the wards? How do you think you'll feel at that time?
I think I'll feel a lot better. When I'm kind of thrown into something and just left to kind of get on with it, like, the first couple of weeks are always, you're like edge, but once you're in, you feel so confident, it becomes like a bit more, like it becomes more normal. So I think, once I get into my job and I kind of start, learning, like everyone says, you learn so much as a Band 5 more than you do as a student, and just knowing that I've got the support of, my team, my seniors, other Band 5s, I think it will make me feel a lot better. And that I can do it, and I will continue to kind of progress and learn everything that I feel I don't know now.
Absolutely, couldn't agree more. I'm sure that 3 months from now you'll look back at this, you'll look back at today, you'll look back at this video and you'll say, crikey, I really didn't think it was going to be that good, but actually I've done really well. And over to Freya and Tianee for the last question to you two. How do you see this going in terms of your future placements? Do you feel as if on your next rotation you might have similar feelings? And if so, how do you think that you'll try and combat with that situation if it does arise?
I guess with any new change, there's always going to be challenges. So we're both really at the early stages of our first rotation, so I think that's where the imposter syndrome is probably more prevalent. But then in 3 months or 6 months, whenever we rotate, it will probably be more challenges again. But I guess that's all part of the learning process, and we'll just use the strategies that we've learned on this rotation and implement them in the next one. And because in A&E there's only one Band 5 physio and there's a Band 5 OT, so for me it's a lot of comparison to the OT, whereas you wouldn't normally have that in a situation where you have more Band 5 physios. I would say a tip is to not compare, because the Band 5 OT has been on 3 rotations before and I've only been there 2 weeks, but it is very easy to compare yourself to others because you both have the Band 5 title. But I think it's about how far in you are within that Band 5.
Totally agree with you. As exactly as you've said, the comparison factor is real, and we'll probably always keep comparing ourselves. But just as you've highlighted there, every rotation that you go on to do, you will have more experience than your first day on the last rotation you did. And doing this 2, 3, 4 rotations into the future, think of how much you're going to learn during that time. And just exactly as you've said, Freya, putting yourself more into that exposure, pushing yourself out of your comfort zone effectively is what it's going to be, because it's not going to feel comfortable. But by pushing yourself and feeling the fear and doing it anyway is going to take you really far. So, ladies and gentlemen, I think that probably wraps up our discussion tonight. If I can quickly summarize some of the brilliant things that Freya, Tianee and Hannah have highlighted tonight. Number one, imposter syndrome is a feeling of insecurity, a feeling of self-doubt, feeling as if you don't belong where you are or that you're not going to live up to expectations. Hannah highlighted different things such as just starting or getting her new Band 5 job, as it were, and that she may not feel ready for that, but at the same time that she has been able to look to other people in a very similar situation to her who haven't had as much experience because of COVID, and that effectively she realizes that she's going to learn a lot on that rotation. Coming over to Freya and Tianee, Freya's highlighted how repeated exposure is definitely going to help. Even if you feel worried about it, do it anyway is really going to help. And Tianee's pressed on about how much support she's gained from her sister and talking to people on a similar level to you about your fears, and that doing so is going to make a really big difference because it's a problem that is then out of here and out into the open, so you can try and come up with solutions with other people who are around you, and especially with mentors, supporters, supervisors who will understand the situation you're in. So all that leaves me to do is to say thank you so much to Hannah, to Freya, Tianee for joining us tonight. Wonderful to see you all here on Clinical Physio. Thank you so much for joining us. Good night from me, and good night, girls. Thank you so much.
Thank you.
Bye. Thank you.